This is One on One. The doctor's in the house. He's back. It was a different studio, but he's back with us right now. He's Dr. Keith Libou, Chief Clinical Officer, Delta Dental of New Jersey and Connecticut. Good to see you, Doctor.
Steve, thanks for having me back.
It's good to have you. Last time we talked all about oral health and a whole range of areas, but I want to jump right into this. Let's shift gears. By the way, Delta Dental, one of the big supporters of the programming we do on oral health. You want to talk about the opioid crisis and how it's related to oral health, and I'm like, huh? Break it down.
Well, Steve, when you look at the opioid crisis, and it's obviously a crisis, and it's affecting New Jersey in a very serious way, you have the illegal opioid crisis, illegal drugs, then you have the prescription aspect of it. And a lot of people believe that people that get involved with the illegal drugs, illegal opioids, start with prescription drugs. And doctors and dentists have done a great job over the last 5 years reducing the number of opioid prescriptions they write. You know, by some accounts, it's down by maybe half. But we know there's still a very serious problem with opioid prescriptions. Some of the doctors who are out there are writing longer prescriptions for more pills. So we came up with two very innovative ways to approach this. The first thing we're doing is working with very large clients that have a very large footprint within the state. We've developed the ability to merge their pharmacy data with our dental data.
How would that help? So you know the pharmacological history, you got the dental data, and what could you potentially find, hypothetically? Let's lay it out. What could you see?
What it lets us do, it lets us identify dentists who, by specialty, are prescribing against the recommended guidelines for opioids in terms of number of pills, number of refills, number of days.
Potentially over-prescribing?
Well, prescribing against the FDA's regulations for opioids.
And then what do you do when that happens?
That's a great question, and that is the question.
So whose job is that to regulate that?
Well, the dentists are exposed to continuing education, and and there's constantly an emphasis to get them to move away from opioids wherever possible.
Is it about education, doctor? So say a doctor is going, as you said, against the prescription protocol. What do you do at that point?
Well, as we identify these dentists who are prescribing against the guidelines, we're going to look at their data, and then what we're going to do is we're going to proactively engage those dentists in a way to just make sure that they're aware of the current guidelines.
Sometimes it's a lack of awareness.
It very well could be a lack of awareness. Now, we're also very aware of the fact there are going to be those dentists who get the most difficult cases. And those are the dentists that there could very well be a very legitimate reason why they're writing what they are. But there is an opportunity to make other dentists more aware of the current guidelines.
Stay on this. And by the way, let's put the website up so people can find out more. First of all, part of the question is answered by what we're doing right now. How are we going to make patients more aware of this? But first of all, it's what we're doing right now. But the other question is, what should patients be doing as they are going in to see their dentist who are learning about this right now? What should they be concerned about, A, and B, asking anything in particular of their dentist?
Absolutely, and that's our second initiative. And what that's going to involve is we've identified a set of procedures that are much more likely to generate maybe discomfort after the procedure, more likely to generate a prescription for opioids. So these tend to be the bigger ticket items like wisdom teeth extractions. So when we get a pre-treatment estimate from the dentist,
right,
asking, just confirming it's going to be covered, how much is going to be paid, when we send the copy of that estimate to the patient, we're enclosing literature that lets the patient know that there are alternatives to opioids that are very, very effective, and that they should engage their dentist. They should talk to their dentist about these alternatives. So it gives us an opportunity to get to the patient before the opioid prescription's even been written.
Let's do this in the time we have left. We've talked about it before, but talk about it again. Dr. Libou, make the connection between gum disease and heart disease.
That is a very important connection. So over the past 15 years, there's been this growing body of evidence, and it gets stronger every year, about the relationship between gum disease and any number of physical problems: heart disease, stroke, diabetes, dementia has been in the news a lot lately. So there's this we're not at the point yet where we can say one causes the other, but we know there's a very strong relationship. People with untreated heart disease, untreated periodontal disease or gum disease are 3 times more likely to die from heart disease.
3 times more?
3 times more.
What about the diabetes piece? Any development since the last time we talked a couple of years ago?
Definitely. So what's happened since then? So the last time I was on, I let you know that Delta Dental was conducting a pilot program through New Jersey where we were having dentists test patients for diabetes. And since then, we have gone to, we went to the state board and they determined it was within the scope of license for dentists to test patients for diabetes. And then we went to the American Dental Association and requested a code for dentists to test patients for diabetes. And then this year, we're covering our members for their dentists to test them for diabetes. The one thing I would want to mention is for patients that have risk factors for diabetes but have not been recognized yet, that's really who this is for. And the test that we're using is called an A1C test.
3 seconds left. A1C test, which is?
3-month blood sugar average. So instead of just a regular blood test, did they have breakfast this morning, it could affect the results. A1C is a 3-month average.
And that information is very valuable.
Very valuable, and patients that test positive would get referred to their physician, potentially identifying diabetic patients years earlier than they otherwise would.
Dr. Libou, thank you so much. As usual, when you're in the house, we learn. Appreciate it. Well done.
Thank you, Steve.
Catch you next time. I'm Steve Adubato. This is One on One.
One on One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 30 years of broadcast excellence. Funding for this edition of One on One with Steve Adubato has been provided by the New Jersey Education Association, Wells Fargo, United Airlines, New Jersey Sharing Network, Holy Name Medical Center, the law firm of Gibbons, P.C., and by Georgian Court University. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.